Let us study about the uterus. This is the anatomical position of the uterus, which lies behind the urinary bladder. This is the body of the uterus. These are the fallopian tubes, and here we can see the ovaries. And this is our vesico-uterine pouch, and here comes our recto-uterine pouch. Coming to the dimensions of the uterus, it is 1 inch thick, 2 inch broad, and 3 inch in length. The supports of the uterus, there are false ligaments and true ligaments. The false ligaments are the round ligament of the ovary, which connects ovary and the uterus, and the other one is broad ligament of uterus, which has 3 main parts. The one that covers the body of the uterus is called the mesometrium of the broad ligament of uterus. The one that lies in front of the ovary, it is called mesosalpinx, and the one that lies behind the ovary, it is mesoovarium. These 3 make the broad ligament of the uterus. Coming to the true ligaments, there are 3 main true ligaments which support the uterus. The first one is Meckelrod's ligament or transverse cervical ligament, which lies at the transverse section of the cervix. The other one is pubocervical ligament. The other one is uterosacral ligament. The other things that support the uterus is the position of the uterus that is placed in our body, that is anteversion and the anteflexion. The musculatures, that is one is pelvic diaphragm and perineal body, also support the uterus. Coming to the blood supply of the uterus, it is mainly by 2 set of arteries. One is right and left ovarian arteries, which come directly from the abdominal aorta, that is gonadal arteries. The other set of arteries are right and left uterine arteries, which come from internal iliac arteries. Venous drainage of the uterus, it is similar to the arterial supply, but the right venous drainage will directly drain into the vena cava, inferior vena cava, but the left veins will drain into renal vein, which will further drain into inferior vena cava. This is the lymphatic drainage of the uterus, which will majorly drain into iliac lymphatic nodes and aortic lymphatic nodes. Looking at the nerve supply of the uterus, it has both parasympathetic, sympathetic as well as visceral and somatic nerve supply. Sympathetic nerve supply help in constriction of the uterine muscles. Parasympathetic helps in contraction of uterine muscles. Visceral nerve supply is by T12 to L2 segments, which is pain sensitive, temperature sensitive, and parasympathetic is for dilation of the muscles, and sympathetic is for constriction of uterine muscles. And the end part or the vagina has the somatic nerve supply, the bipudendal nerve, which is touch sensitive. Thank you.
So the uterine artery crosses the ureter. So in case of the cancer of the cervix, the uterine artery may get swelled with there will be development of mass around the uterine artery, which will block the ureter. As the ureter will be blocked, there will be chances of the failure of the kidney. Ovarian cysts are referred to as chocolate cysts. This is due to the fact as the menstruation starts, the ovary appear to be greyish in color. So next, talking about Druckenberg's cancer, the lymphatic drainage of the ovaries are richly connected to the entire body. So sometimes carcinoma from the breast may come to the ovaries and the entire uterus. This is known as Druckenberg's cancer, that is the cancer spreads.
Thank you.
Thank you.